Botox, which is botulinum toxin, which is a neuromuscular agent. And then there are fillers. Fillers are volumizers, substances that are placed into the skin to add more volume. They're two very different categories of injectable products, and they're used quite differently. Botox is used to smooth out wrinkles that are caused by the pull of dynamic muscles, or dynamic wrinkles as we say. The most common application for botulinum toxin is around the upper face. Typically, and this is Nicole. She is one of our office nurses, and she's been gracious enough to help out with this video. Of course, she does not need Botox at this stage, but at any rate, just for illustrative purposes, we're going to review how we use it. Botox is usually used most commonly on the upper part of the face. And we look at it, again, as a product that weakens the pull of muscles. And all that is involved with the use of Botox is about this push and pull effect of selectively weakening some muscles while allowing other muscles to offset that and create some dramatic effects. So, the more common areas that we use Botox will be, again, around the face and around the upper face. Particularly one common area is the area between the eyes. Here we can often get something called glabella furrows. I don't see any right now, but if Nicole was to bring her eyebrows together, we can see this accentuation of these lines. Well, these are caused by the action of two very strong muscles that come in a diagonal fashion this way, and these are called corrugator muscles. Well, you can imagine if we were to selectively weaken this muscle by the injection of our Botox, then that pull would be gone. The effect of that is to counter the natural tendency to come together, which results in a gradual weakening of that pull and smoothing out of the forehead. Well, the effect goes beyond just the wrinkles. It actually elevates and gives a slight upward direction to the medial brow, which is another desirable effect of that. The other area on the upper face where we'll use Botox is with the vertical lines that can develop over time of the face. Do you have any of those? Raise your eyebrow for me, raise them. Here we go, these lines here. Now these are lines, relax now, are the result of the frontalis muscle. This is a large flat muscle that exists in the mid portion of the frontal area of the scalp and of the forehead. And by relaxing this muscle, these creases would disappear as well. It's much like a curtain effect. Curtain in a movie theater. As it goes up, it pulls and creates those wrinkles. If we can relax it, those wrinkles will go away. And so the way that we treat that is by selectively placing a series of strategically made spots where the Botox will be injected. And this does extend out slightly laterally. But with everything, we have to be careful how we're using the product. If we were to take the product too low, it would have a negative effect on the brow line, which actually could drop the brow. So there are limitations to what we can do, and that's kind of important to know, because sometimes people come in with requests that perhaps are a little bit unrealistic or not really something that we can achieve without some other secondary loss. The other major area that we often will use Botox is around the eyes. And if you would squint for me really tight, we can see, okay, now relax. We can see that typically as we age, we get a series of lines along the sides of the face, which are called by the common name crow's feet. Turn your head this way. The crow's feet are the result of a circular muscle that exists around the eye, called the orbicularis muscle. And when it contracts, it creates these vertical lines. Well, the concept here with Botox is to place it in a series of strategic locations to weaken some of that pull and open up the lateral portion of the eye, making the wrinkles smoother and actually opening up the eye a bit as well. That's done carefully, again, because we don't want to be inside the orbital rim. So you would typically a finger breadth outside. We may strategically place 1, 2, 3 injection sites, perhaps a fourth one coming more centrally over towards the area underneath the lid just slightly. Another area that we might want to treat is essentially right over the center of the nose, where some times individuals develop a crease which is often called a bunny line because it tends to wrinkle up that way. And we can soften that also with a very selective injection of Botox into the nasalis muscle that lines the top of the nose. So those are the most common areas where Botox is used in the upper face. We have seen some extensions, and these are really actually off-label use of this product to the lower face. Sometimes around the mouth, there's a circular muscle called the orbicularis that encircles the mouth, and as that purses up, it can create vertical lines in the upper lip. Very small, minute amounts of Botox can be injected along the corners of the mouth and perhaps more towards the central lip to loosen some of that muscle pull and open up some of those vertical creases. But again, care has to be taken not to overdo this, to overly weaken that important muscle function, which is important for speech and for eating and drinking. Sometimes there can be very strong creases to the lower chin. These too can be treated with Botox very selectively, softening some of that pull, taking some of the tension off of the chin, and helping to smooth it out. Finally, I'll mention the lower neck. There is a apron-like muscle that starts at the clavicle and extends up to the lower aspect of the jaw, and this is called the platysma. As we age, this muscle often gets a little bit more laxed, and also the overlying skin itself can also become lax, and these bands actually become visible. Well, one way of temporizing their appearance or making them hide is actually to weaken them by injecting selectively a little bit of Botox along the free edge of those bands, and then over time it almost melts away. So there you have it. Those are some of the applications that we have for using botulinum toxin to help soften some of the actions of the muscles that give rise to wrinkles. There are different ways of constituting Botox, and it's important that you ask your provider just how they do it. It could be concentrated as much as 4 units per 0.1 cc, or it could be as little as 2 to 2.5. Everyone has their preferences. We tend to use a standard mixture of about 3 units. With that, I can titrate well, and it can give a natural look, but not an overdone look. If you would like more information on injectables, botulinum toxin, Botox, please feel free to give us a call, and we'd be happy to answer any further questions. Take care.